Have you ever pondered on the significance of understanding cardiovascular drugs, particularly in treating arrhythmias? Cardiovascular drugs, such as anti-arrhythmic agents, play a critical role in managing heart conditions. They are the heroes behind the scenes, maintaining the rhythm and pace of our beating hearts. Without them, treating arrhythmias, which are irregular heart rhythms, would be a Herculean task. Their importance can't be overstated. They're not just pills or injections, they're a lifeline for many. For healthcare professionals and medical students, understanding these drugs is akin to having a roadmap. It guides them in the right direction when navigating the complex landscape of heart diseases. Knowing how these drugs work, their side effects, and their interactions with other medications is vital. It's the difference between a well-managed condition and a potential health crisis. With a deep grasp of these drugs, healthcare professionals can make informed decisions, ultimately saving lives. Our journey begins with the discovery of these life-saving drugs. The genesis of cardiovascular drugs, like many medical breakthroughs, was steeped in curiosity, determination, and a dash of serendipity. In the late 19th century, the understanding of heart diseases was still in its infancy. Physicians and scientists were grappling with the complexities of the heart and its associated disorders. Amidst this backdrop, Sir James Mackenzie, a pioneering Scottish cardiologist, made significant strides in understanding heart rhythms and their abnormalities. His work laid the groundwork for the development of anti-arrhythmic agents. Fast forward to the mid-20th century, when the first effective anti-arrhythmic drug, quinidine, was discovered. Derived from the bark of the cinchona tree, quinidine was initially used to treat malaria. However, physicians soon noticed its potential in controlling heart rhythm disturbances. The discovery of quinidine was a major milestone in cardiovascular medicine, providing doctors with a new tool to combat deadly cardiac arrhythmias. But the evolution of cardiovascular drugs didn't stop there. Over the years, researchers continued to explore and innovate, leading to the discovery of several classes of anti-arrhythmic drugs. Each class works differently, targeting specific channels in the heart cells to regulate heartbeat, making them effective for different types of arrhythmias. The discovery of beta blockers in the 1960s further revolutionized cardiovascular treatment. These drugs, by blocking the action of adrenaline on the heart, reduced the heart's workload and helped manage conditions like hypertension and angina. Fast forward to today, and the landscape of cardiovascular drugs has expanded exponentially. From ACE inhibitors to calcium channel blockers, from statins to anticoagulants, each class of drugs plays a crucial role in managing a plethora of cardiac conditions. From their inception, cardiovascular drugs have been a game changer in the medical field. They have improved the quality of life for millions of people worldwide and continue to be an integral part of modern medicine. It's a testament to the relentless pursuit of knowledge and the power of scientific innovation. So as we delve deeper into the world of cardiovascular drugs, let's remember the journey that brought us here and the countless lives that have been touched along the way. But how exactly do these drugs work within our bodies? Well, cardiovascular drugs, particularly anti-arrhythmic agents, work by interacting with the electrical system of the heart. They help regulate heart rhythms and maintain a steady heartbeat. Now, let's delve a little deeper. The heart's rhythm is controlled by electrical signals. These signals can sometimes go haywire, causing irregular heartbeats or arrhythmias. This is where anti-arrhythmic agents come into play. These drugs are designed to correct irregular heart rhythms and bring the heartbeat back to normal. There are 4 classes of anti-arrhythmic drugs, each working in a different way. Class 1 drugs, for instance, work by blocking the sodium channels in the heart cells. These channels are responsible for the rapid influx of sodium ions during the depolarization phase of the cardiac action potential. By blocking these channels, Class 1 drugs slow the rate of depolarization, reducing the heart's electrical conductivity and correcting the arrhythmia. Class 2 drugs, on the other hand, are beta blockers. They work by blocking the action of adrenaline on the beta receptors of the heart. This slows the heart rate and reduces the force of the heart's contractions, thereby controlling arrhythmias. Class 3 drugs prolong the action potential duration and refractory period of the heart cells. They do this by blocking potassium channels, delaying repolarization, and thus preventing the occurrence of premature heartbeats. Lastly, Class 4 drugs are calcium channel blockers. They inhibit the influx of calcium ions into the heart cells, slowing down the heart rate and decreasing the force of contraction. It's important to note that these drugs do not cure arrhythmias. Rather, they control them, allowing individuals to live healthier, more comfortable lives. So whether it's by blocking sodium, beta, potassium, or calcium channels, these drugs all aim to regulate the heart's rhythm, ensuring it beats in a normal, steady manner. The way these drugs function is indeed a marvel of medical science. Fast forward to today, how are these drugs being utilized? Cardiovascular drugs are now an integral part of modern medicine. They are used extensively to manage and treat various heart conditions, with particular emphasis on arrhythmias. Arrhythmias, or irregular heartbeats, can be potentially life-threatening, and anti-arrhythmic agents are the superheroes that swoop in to save the day. These agents work by regulating the heart's electrical impulses, effectively restoring the heart's rhythm and rate. They're a bit like the conductor of an orchestra, ensuring every part of the heart plays in harmony. The result? A smoother, more efficient heartbeat. There are 4 main classes of anti-arrhythmic drugs, each with a different mode of action. Class 1 slows down the conduction of electrical signals, Class 2 reduces the heart rate, Class 3 prolongs the period of electrical activity, and Class 4 reduces the strength of the heart's contraction. This diverse range of actions allows healthcare professionals to tailor treatment to the unique needs of each patient. But it's not all about arrhythmias. Cardiovascular drugs also play a crucial role in managing other heart conditions. For example, ACE inhibitors and beta blockers are used to treat high blood pressure and heart failure, while statins are used to lower cholesterol levels and reduce the risk of heart disease. From preventing heart attacks to managing chronic conditions, these drugs have transformed the landscape of cardiovascular care. They've bought us time, improved quality of life, and saved countless lives. They're not just pills or injections, but lifelines for millions of people around the world. But despite their widespread use, it's important to remember that these drugs are not a cure-all. They are tools, used alongside lifestyle changes and other treatments to manage heart conditions and improve patient outcomes. They're a part of the puzzle, but not the whole picture. Indeed, cardiovascular drugs have become a cornerstone in the treatment of heart disorders. The impact they've had and continue to have on global health is nothing short of remarkable. As we look to the future, what does the horizon hold for these drugs? A promising question indeed. The future of cardiovascular drugs, particularly anti-arrhythmic agents, is filled with potential advancements and ongoing research. Heart diseases continue to be the leading cause of mortality worldwide. Hence, the need for effective cardiovascular drugs is not only immediate, but also persistent. It's a race against time, a race that we, the human race, are determined to win. The realm of anti-arrhythmic agents is vast, and we've only scratched the surface. The complex mechanisms of these drugs provide a playground for researchers to explore, innovate, and refine. Imagine an era where cardiac arrhythmias can be managed with precision, where side effects are minimal, and the quality of life is not compromised. That's the future we're striving for. Ongoing research is focusing on personalizing medicine based on genetic makeup. The concept of one-size-fits-all is gradually fading, making way for personalized treatment plans. Tailoring anti-arrhythmic drug therapy to an individual's genetic profile could potentially improve efficacy and minimize adverse effects. The development of novel drug delivery systems is another exciting avenue. These systems aim to target drugs directly to the heart tissue, thereby maximizing therapeutic effect while minimizing systemic side effects. The future also holds promise in the realm of disease-modifying therapies. These are drugs that do not just manage symptoms, but also alter the course of the disease itself. Imagine a world where we don't just control arrhythmias, but prevent them from occurring in the first place. The continuous evolution of cardiovascular drugs is a testament to human ingenuity and resilience. As we move forward, the need for understanding these drugs and their sophisticated mechanisms becomes all the more crucial. It is a journey of discovery, a journey towards a healthier future, a journey that each one of us is a part of. As we continue to unravel the mysteries of the heart, these drugs will always play a pivotal role. Subscribe for more because you won't find me later. Let's quickly revisit the key points we've discussed today. We kicked off with the significance of understanding cardiovascular drugs, highlighting their vital role in treating heart-related diseases. We then took a journey back in time to the discovery of these life-saving agents, appreciating the scientific leaps made over the decades. Diving deeper, we explored the intricate mechanism of cardiovascular drugs, shedding light on how they work at the cellular level to regulate heart function. We also discussed their current uses, such as treating arrhythmias, heart failure, and hypertension, demonstrating their versatility in managing a range of cardiovascular conditions. Lastly, we touched on the future prospects of these drugs, acknowledging the ongoing research that could lead to more effective and targeted treatments. Remember, understanding these drugs is not just about knowledge, but about improving and saving lives. That's why it's so crucial. So stick around for more enlightening topics, and don't forget to subscribe because you won't find me later.